A very good afternoon to one and all. I'm Dr. Sumaya Ikra, second year PG scholar in the Department of Kaya Chikitsa, GMC Mysuru. It gives me an immense pleasure to host the third day of the national webinar on kidney disorders, that is VRUKKA PRAKARSHA 2023. It is organized as a part of Golden Jubilee celebration from the Department of PG Studies in Kaya Chikitsa, Government Ayurveda Medical College, Mysuru. I offer my hearty welcome to the eminent scholar of Ayurveda and our guest speaker for today's session, Dr. Manish Patel, Professor and Head of PG and Doctoral Department of Kaya Chikitsa, JS Ayurveda College, Nadiad. I welcome you, sir. I would also extend my welcome to Dr. Radhakrishnan Ramarao, sir, our principal, to our HOD, Dr. Maitri RC ma'am, and to all the staff of Department of Kaya Chikitsa, and also to the HODs and staff of other departments. Lastly, I also welcome the viewers who are virtually and actively participating in this event. I now request Dr. Harshita to give an introduction about today's guest speaker. Thank you.
Om Shri Gurubhyo Namaha. Very good afternoon to one and all. I am Dr. H.S. Harshita, second year PG scholar, Department of Kaya Chikitsa, Government Ayurveda Medical College, Mysuru. It's my proud privilege and honor to introduce today's distinguished speaker, Professor Dr. Manish Patel, sir. Sir has completed MD and PhD in the subject of Kaya Chikitsa and is presently working as a professor and head of postgraduate and doctoral department of Kaya Chikitsa at prestigious NAC and NABH accredited JS Ayurveda College, a constituent college of Maganbai Adanwala Mahagujarat University, Nadiad. Sir has always been an eminent clinician, teacher, and researcher with more than 20 years of clinical experience and 17 years in teaching and research. Sir has published more than 38 research articles in reputed international peer-reviewed journal, having good impact factor. Sir has guided 21 PG and 8 PhD students so far. Highlighting about Sir's research credentials, Sir started research work in 2008 on the subjects in which there was only paucity in Ayurvedic field for clinical research and started to evaluate the effect of Ayurveda therapy in chronic renal failure, urinary incontinence, ulcerative colitis, nephrotic syndrome, cirrhosis of liver, and diabetic sensory polyneuropathy. Sir worked in the field of Ayurveda research together with some European scientists of Karaite Medical University, Berlin, Germany, and European Academy for Ayurveda, Bernstein, Germany. Sir has always been an eloquent orator, accentuating his academic credentials. Sir, since 2019, has delivered more than 5,000 hours of speech on principles and practice of Ayurveda in the Ayurveda education program for foreign medical and paramedical students, mainly from Germany, Austria, and Switzerland. More than 500 medical and more than 1,000 paramedical foreign personnel were clinically trained for Ayurveda practice by Sir. Recently, Sir was also invited by Goa Council of Ayurvedic and other allied systems of medicine, Government of Goa, as an expert for making SOP for the management of chronic kidney diseases, which was released by Honorable Chief Minister of Goa on 29th of October 2023. Sir is also a member of Reviewing Board in World Journal of Transplantation, American Journal of Case Reports, Annals of Ayurvedic Medicine, World Journal of Gastroenterology, Journal of Ayurveda Case Reports, and many of the reputed indexed journals. He has also got Outstanding Peer Reviewer Award by World Journal of Transplantation, which is indexed in PubMed, Scopus, and Web of Science and run by one of the reputed B6 medical publications. Owing these varied credentials, Sir has proven to be the most justifying speaker on today's topic, being Samprapti-based management of various kidney disorders case studies. With this brief introduction, I offer my sincere salutations to our eminent guest speaker for today, Professor Dr. Manish Patel, sir. And on behalf of Department of Kaya Chikitsa, I wholeheartedly welcome you, sir. With this, we hand over the virtual platform to you, sir. Kindly take over the session. Thank you, sir. Thank you, one and all.
Harshita, am I audible for everybody?
Yes, sir, you are audible, sir.
This is the Okay, so the PowerPoint presentation is also running at present. Everybody can see it.
Yes, sir, it is visible, sir.
Okay. So first of all, I want to gratitude to my guru, Professor S.N. Gupta. When I was a student in this college, he was my professor, and presently I am proud to say that I am working with him presently also under his vice chancellorship of our university. And he has inspired me towards the Ayurveda practice because, as we know, everybody, we come here in Ayurveda specifically, not for the Ayurveda, but I specifically came in the Ayurveda field because I didn't get the opportunity to learn the medical science in government colleges. So I came here in Ayurveda, but he inspired me. And in the fourth year, when he started the lecture, I really understand what is Ayurveda and what Ayurveda can do. So that's why he is really a preceptor of my educational preceptors, and he was a pioneer of the Ayurveda management of the treatment of the CKD, and he is treating the patient since 1990. So I am touching with him in the CKD and other renal related disorders patient since 1994. So first of all, we directly jump to our main topic. The topic is the Samprapti based Ayurvedic management of various kidney disorders. So in this topic, mainly two things are there. One is glomerulopathy, and another disease is the CKD, that is the chronic renal failure. In various kidney disorders, first group of the disorder is the glomerulopathy disorders. In this lecture, I show you the first, mainly the mechanism of the injury in the kidneys according to the modern medical science, and then we understand that mechanism of the injury according to the Ayurveda side, Ayurveda view, and the treatment strategy. Then we learn to make the treatment strategy through that samprapti, and according to that samprapti, whatever the treatment strategy we made and we are using in our hospital since many years, the results of that samprapti analysis based treatment I will show you, because some case studies also published on this treatment and treatment strategy. So that results I will show you. So first, in the glomerulopathy, there are two glomerulopathic disorders are there. One is nephrotic syndrome and another is nephritic syndrome. I do not use any specific Ayurveda terminology because in my opinion is that there is no direct terminology of Ayurvedic terminology mentioned in any classical textbook of Ayurveda which can directly or indirectly correlated with that disorders. The nomenclature, any nomenclated disease in the classical textbook cannot directly correlate with any glomerulopathic disorders or even in chronic renal failure. So better to use the terminology which we can understand. That is the modern medical science. We know the nephrotic syndrome, we know the nephritic syndrome, we know chronic renal failure. So if we do not have a specific terminology specifically for these disorders, then we cannot use like show there are other things. That I will tell you later on what actually we can go, how can we understand these whole disorders through Ayurveda way. So first in glomerulopathy, nephrotic syndrome and nephritic syndrome we discussed. So actually in chronic glomerulopathy, first microalbuminuria is started. So when patient come to us, whether because of the any reason, diabetes mellitus or any other disorders, first microalbuminuria started. Then this microalbuminuria later on, when injury is more, it start with macroalbuminuria, or we can say it is the selected proteinuria, because at here in this case albuminuria is in more quantity than microalbuminuria, but still at this phase patient urine contains only albumin, so it is selected proteinuria. And then again, if injuries continue, then it is subnephrotic range of non-selective proteinuria. So now the patient is passing the not only albumin but also the other form of the proteins inside the urine. So it is non-selective proteinuria. Any of the protein can be passed into the urine, but still the range or the amount of the proteinuria is not as much as like the in another clinical condition. So that's why this condition or this phase of the glomerulopathy is also called as the subnephrotic range of the non-selective proteinuria. And if injuries continue, again it's the nephrotic range of the proteinuria, which we already understand that if protein is more than 3.5 gram in urine per day, then it is nephrotic range of proteinuria, or at here we can give the name as a nephrotic syndrome. All above conditions are not nomenclated or cannot be, we cannot say that, we cannot give the name as a nephrotic syndrome patient. But when patient passes the nephrotic range of the proteinuria, then it is nephrotic syndrome. And if injury continues, then the crescentic glomerulopathy is developed. And this, because of this crescentic glomerulopathy, there are severally glomeruli blockage, and GFR is decreased. So automatically we can consider this condition as a chronic renal failure. And this crescentic glomerulopathy can also directly from nephritis, any kind of nephritis like nephritic syndrome. Nephritic syndrome, there are certain disorders or clinical condition like post-streptococcal glomerulonephritis or progressive glomerulonephritis, rapidly progressive glomerulonephritis, IgA nephropathy or like that. So these all are nephritis. They can also directly converted into the crescentic glomerulopathy without microalbuminuria or other up to the nephrotic range of proteinuria. So crescentic glomerulopathy can be possible through two ways. One, it is from the nephrotic range of proteinuria, and another directly patient goes into the crescentic glomerulopathy through direct nephritis. And crescentic glomerulopathy ultimately developed the CKD, which is renal failure, and which require the renal replacement therapy. So this is the glomerulopathies. Now the two different kind of syndrome or clinical pictures of the glomerulopathies are there. One is nephritic and another is nephritic syndrome, and another is nephrotic syndrome. Earlier nephritic syndrome is called as the nephritis, but now since last 7-8 years the nephritic syndrome term is developed, because in both the clinical pictures nephritis is common, which is called as the inflammation in the nephrons. So any kind of inflammation in the nephrons, it is abbreviated as the nephritis. So nephritis can produce any of these clinical pictures, nephrotic syndrome or nephritic syndrome. In both the cases nephritis is common, but according to the varieties of the nephritis, the clinical pictures is varies, and these clinical pictures in the two form, and that's why these two clinical different clinical pictures, one is called as the nephrotic syndrome and another is the nephritic syndrome. But in both the clinical syndrome, nephritis is common. So histopathologically we can say that the main cause, histopathological cause for both the complaint or both the clinical pictures is nephritis. And we do not have much more time, so I cannot show the exactly FSGS and MPGN and MSGS like that. They are also the primary nephrotic syndrome and other ways of the nephritic syndrome. But what is the nephrotic and nephritic? In nephrotic syndrome, it is high proteinuria more than 3.5 gram per day. mostly autoimmune process, primary nephrotic syndrome in 99% cases, and few types develop the azotemia, means the majority, only FSGS mostly, they develop the CRF in the later stages. So azotemia developed in few amount of nephrotic patients, but in nephrotic patients, nephrotic syndrome, it is characterized by the oliguria and hematuria. Very less proteinuria is found, or sometimes no proteinuria, but hematuria is common. And majority of the patients of the nephritic syndrome, they developed the CRF or structural loss of the nephrons. We can say that it is the azotemia. And few cases of the nephrotic also may develop the nephritic syndrome. So some patients of the nephrotic syndrome, they also converted into the nephritic syndrome cases, and after that nephritic syndrome, after some years, they all again developed the CRF. So this is the pattern of the glomerulopathy. Now, main focus, according to the today's topic, it is the Samprapti based treatment. So first we understand the Samprapti of the common glomerulopathy. So mechanism of the injury in the glomerulus, mainly it is, we can understand that, or we can bifurcate all the causative factors or all the mechanism of the injury in the glomerulus into the four main. One is circulating immune complex, another is in situ immune complexes, third one is cell mediated types of immuno immune process which can which can create the injury in the glomerulus. And number fourth is the toxic mediated mechanism of the injury. In this case, immune process generally have a very less, that is the podocytes effacement, that we do not include it here because it is a minor injury and it can also heal if toxicity is removed. So only four mechanism of injury is mentioned at here, which is the main. The fourth one is the activation of the alternate complement pathway. But all these four procedures are autoimmune process. And if there is autoimmune process, anyone or more than one of any of these process can happen inside the body and which are responsible for the injury in the glomerulus. So this is the modern mechanism. Very superficially I have told you that, because if you want you can go detail inside this all autoimmune process, but it is none of our business now, or it requires too much time. So our main focus is to find out the samprapti of the Ayurveda and just to make a treatment strategy up to according to the analysis of the samprapti. So now we understand whole this process according to the Ayurveda. So according to Ayurveda, we know that kapha or shleshma, which is mentioned in the classics, they are responsible for this immunity or these types of mechanism in our body. So this kapha is one of the rasadhatu, or it can derive from the rasadhatu, or also it has also separate factors. And two types of shleshmas are mentioned in the classics, prakrit and vikrut. Because in the this vikrut shleshma, it is as a mal of the rasadushti. So when rasadhatu vitiates or rasadushti is there, then whatever the shleshma or kapha produced as a mal of the rasadhatu, they are the vikrut shleshma. And why we can how we can bifurcate these prakrit and vikrut shleshma? Because in the Charak Samhita there is one statement, that is the prakrutastu balam shleshma vikruto mala uchyate. So if prakrut bal is there, that is the shleshma. So shleshma is also, we can understand that prakrut bal and vikrut bal, they are also prakrut and shleshma and vikrut shleshma. So vikrut shleshma is just like a mal, and or mal we can say it is vikrut, and prakrut bal is the shleshma. And one another statement in the Charak Samhita, that is the balam hi alam nigrahaya rogana. So bal is only the responsible factor which prevent the disease from the body, or body can be prevented by bal from the diseases. So if you can, the factor which is responsible to prevent the disease, that factors is the immune process. So we can say that bal is immunity. So generally we say that bal is strength, but strength is not, it is just a translation of the bal. What actually bal mentioned in the Ayurveda, that is this reality. Because balam hi alam nigrahaya roganam, that means the bal is responsible for the immune process. So whatever the immunity, whatever cell mediated immunity or immune complex related immune mediated, B lymphocytes, T lymphocytes, all these immune mechanisms, normal immune mechanisms, they all are because of the bala according to Ayurveda. And how can we increase this bal? If we have proper ojas, then bal is increased. So ultimately the khel is of ojas. So ojas plays a major role for maintaining our immune process. I am not telling that ojas is immune process. Ojas is responsible. Ojas is the factor which is responsible for the proper mechanism of our immunity. So if ojas is proper, then increment of the ball or ball is in proper way. It is prakrut ball, and that's why this ball is responsible for the proper mechanism. But when this ojas is vitiated, there are three types of vitiation of the ojas in the classics mentioned. That is the ojobrans, ojavyapad, and ojavisrans. Personally, I believe that this is not in any classical literature, but my personal opinion is that, as per my opinion, these three classical statement, Oj Visrans, Oj Vyapad, and Oj Kshay. Oj Kshay we can directly correlate it with the immune deficiency disorders like HIV infections or all other disorders in which the patient's immunity is, or when patient immunocompromised. That is Ojas Kshay. Oj Vyapad, in classics, commentator has mentioned that Vyapad, Oj Vyapad is because of the vitiation of the Ojas by dosas. So when dosa vitiate the Ojas, Oja Vyapad is there. So all types of allergic disorders can be considered as a Oj Vyapad. And if you see the symptomatology of the Ojas Vyapad and Ojas Kshay, you can find that all symptomatology of the allergic mechanism of the disorders according to the modern science, or immunodeficiency disorders of the modern science, they are similar, which is mentioned in the Ojas Kshay and Ojas Vyapad symptomatology. And another thing is that very important for us, that is the Oj Branch or Oj Visransh. Visransh and Branch are both are there. In our local language, we say that anybody who are not working properly, we say it is a brasht buddhi. इसकी बुद्धि भ्रष्ट हो गई है, भ्रंश च्युत हो चुका है बुद्धि से. मतलब कि that means anybody are not doing the proper things which they have to do. So that is the branch. So when O's or any mechanism which is inside the body cannot create its functions properly and create something else which is not required or which is not its own function, that is the branch. So Oj branch, that is the Oj branch, that is the Bal branch. Because Oj is responsible for the Bal function. So when Oj branch is there, we can say it is Bala branch. So Bala is immunity, so Bala branch, that is the autoimmunity. So Oj Visrans, it is autoimmunity. All types of autoimmune disorders, that is Oj Visrans or Bala branch. And that means this Bala branch is responsible for the autoimmune process. So I understand, I told you that what is autoimmune process according to Ayurveda. According to Ayurveda, autoimmune process we can directly correlate it with the Balabhransh. And Balabhransh, it is the Vikrut Shleshma, It is because of the rasadushti, because of the vitiated ojas, because of, or we can say that it is vikrut sleshma, and one another fourth one, that is ama. When you see Ashtanga has mentioned that the common symptomatology of the ama, that is common symptomatology of the ama, that is the srotoroda, yes, srotoroda balabhransha. So ama is responsible for the balabhrans. All balabhrans can also possible in the body when there is ama inside the body. So not only the vitiation of the rasadhatu or vitiation of the ojas or vikrutashlesma can create the balabranch, but if you have ama inside your body, balabranch is also possible. So that's why finally we conclude that vitiated ojas, rasadushti, vikrutashlesma and ama, they are the responsible for the balabranch, and balabranch is nothing else but it is the autoimmune process. So mechanism of the injury in the glomerulopathy, we can say that behind this autoimmune process, any one or more than one of these four vitiated ojas, rasadushti, vikrutashlesma, and ama, any one or more than one of these four factors inside the body is responsible. Now, if we want to make the treatment strategy, then we have to consider all these four, because they are the balabranch or autoimmune process, and autoimmune process is responsible for the glomerulopathy or nephrotic syndrome. So for treatment of the nephrotic or nephritic syndrome, we have to consider all these four. We have to correct it. We have to increment inside these ojas or whatever. So rasadushti, vikrutashlesma, vitiated ojas, and ama, these are the factors. And among these factors, first three factors, rasadushti, vikrutashlesma, and vitiated ojas, they should be corrected, and or increment of the ojas is required. So that should be one of the treatment strategy. If we want to treat the patient of nephrotic or nephritic syndrome, then one treatment strategy should be like this. Another thing is that how we can correct the ojas, or how we can increase the ojas, because rasayan karma is rasasya ayanam, rasadinam saptadinam dhatunam that is the rasayan. So rasayan, it is the increase the quality of the tissues, and quality of the tissues is nothing else, it is the ojas. So rasayan karma and sadavritta, sadachar palan, they are the responsible for the increment of the or correction of the ojas. Now another thing is ama. How we can remove the ama? By increment of the agni, and another process is amapachana. So our treatment strategy, main treatment strategy, or we can say the chikitsa sutra, which is not mentioned in the classical textbooks, now we have made it through all classical references. So main three treatment procedures or chikitsa sutra is, one is rasayan karma and sadavritta palan, second is amapachana or increment of the agni, and third one is the lakshanik chikitsa, which is mentioned for everybody or all disorders, that is the dosha pratyanik and vyadhi pratyanik. So like shothar chikitsa or mutral chikitsa, that is already lakshana of the nephrotic syndrome, which I do not deliver at here because we do not have much more time. So but in nephrotic syndrome, mainly symptoms are oliguria and swelling. So Shothar and Mutral, these are the main treatment. If it is mentioned in the classics, we can use like this. So main three treatment strategies are there, and now we have to use the medicaments or procedures. So for Rasayana Karma, Vardhamana Pipli Rasayana is mentioned. Why I have mentioned this Vardhamana Pipli Rasayana first? Because Vardhamana Pipli Rasayana is not only acts as a rasayan procedures, but it also mentioned as a shothar. Shoth is also indicated. Plihodar is also indicated in Vardhaman Pipli Rasayan. And Pipli itself increase the Agni. Pipli itself remove the Ama. So Ama Pachana is possible through the Pipli. So if you go for the Vardhamana Pipli, all above 3 treatment strategy is possible only through Vardhamana Pipli Rasayan. So Vardhamana Pipli Rasayan is just like a arrow of the Lord Ram Bhavan. It can create all 3 treatment strategy. Another is Haritaki Rasayan, that is Kansa Haritaki. It is mentioned in the Shoth Chikitsa. So that's why I have mentioned Kansa Haritaki specifically at here. Because Haritaki Rasayan, there are many Rasayan of the Haritakis is mentioned in the classic, but among them Kansa Haritaki or Brahma Rasayan, which is also Amalki and Haritaki's mixture, they all are good in these cases. Another is Ballatak Rasayan, but Ballatak Rasayan is also having its own side effects. Specifically, it creates the hematuria. So when nephritic syndrome is there, in which condition pitta increased, then it is difficult sometimes to tolerate by the patient. So Ballataka Rasayana generally I do not prefer. And another Lakshanik Chikitsa is there Punarnava, Ikshumula and Haritakyadi Kvat, which is mentioned in the Sharangdar Samhita in Mutraputra Adhikar. So Vardhamana Pipili Rasayan, now in present era, 1000 Pipili is too much for the patient. As per my experience, if we go for the 1000 Pipili Prayog, then nearly in the middle timing period, patient cannot tolerate the maximum dose of the Pipili. So we use modified dose pattern of the pattern of the one Pipili Rasayan is the same, but we use the modification in the dose only. So this is the Pipili Rasayan Prayog which we are using in our practice since many years. So first day we give the 1 gram Pipili in chuna form. On second day 2 gram, third day 3 grams, so and increase 1 gram every day. So patient have Pipili 5 gram on the 5th day. Then we continue this all 5 gram Pipili consecutively for next 4 days program. And then we start decrease 1 gram dose of the Pipili from 10th day of, and patient reach 1 gram Pipili on the 13th day. Then after the 14th on the 14th day, without any Abhyanga, without Svedana, we directly go for the Virechana. That is one type of Koshta Shuddhi we can say. It is not a proper Virechan Karma which is mentioned according to the classics like in Panchakarma therapy, like Snehapana, Abhyanga, Svedana and then Virechana Karma. But we can say that it is the Rechana or Koshta Shuddhi, because after the Pipali, there are Pachana is there. See, there is a basic concept which is mentioned in the classics. There are 2 varieties which can show you a whole Panchakarma procedures. That is, one is the doshas, Koshthat, Shakhadi Gamanam. That is the Roga Vigna. And second thing, from Shakhat Kushtadi Gamanam. That is the mainly useful. We use these fundamentals for our Panchakarma procedures. So one factor which is responsible for the Kushthat, for Shakhat Kushtadi Gamanam, that is the Pachan. Vruddhyat, Vishyandanath, Pakat, Srotomukha Vishodhanath. So Pakat, if you go for the Pachana Karma, then also doshas come into the Koshta, they are free from these channels and come into the Koshta. Now, if after the Pachan Karma, some form of the doshas is come into the Koshta, then there is no need to go for the Shodhana, for the Snehana, Abhyanga, Svedana. Directly they are already come into the Koshta. You just remove them by simple adding any purgative medications. So this is my opinion personal for why we are giving the Virechana Karma after specifically for Vardhamana Pipili Rasayana and how it will work like that. And another is Nirubasti, but this is not for all the patients, because in many patients of the nephrotic syndrome or nephritic syndrome, they are severely swollen all over the body and asarca is there and they are very weak. Albumin is also less in the patient, and if you go for the Virechana Karma, if they are or if you go for the neurobasti for longer period, then every day or longer period of the neurobasti can create also the hypoalbuminemia. So it is optional. If patient is balwan, very strengthful, less preda is inside the body, or less anasarca, no anasarca, and very less swelling is there, then we can continue for the continuous neurobasti, otherwise not. Then the Brahma Rasayana, Haritakyadi Kashaya and Punarnava Churna. That's we are using. Dose is also mentioned at here. The diet, mainly milk diet, only milk diet, where ascites is there, because 70 or more than 70% patient of the nephrotic syndrome, they have ascites as a complication. So if patient has ascites, then only milk diet is there. If there is no ascites, then milk, restricted milk, only 200 milliliter milk diet is there, because some protein is also acts like a allergens and create the autoimmune process. Water and salt restriction, and we are instructed to the patient that they have to use only mung beans, rice, takra, and boiled vegetables. Boiled vegetables are also those which are easy to digest and non-slimy. And if patient want to eat chapati, then they are always only they can use the rice flour or mung bean flours. No any other flour. No jar, no millets, no anything. No wheat, nothing. Only chapati. They can use mung beans and rice. Whatever the uh, items they want to eat, they are only from rice or only from mung beans. Now the results related to the treatment which we are using, which we have mentioned already. This treatment, these things which is mentioned at here, this treatment we are using since many years in our hospital, and we have published one article which is the link is also at here. You can directly download through this link. It is freely available PDF form of this paper. It is published in 2015. The results of this case are improvement in the signs and symptoms. So before starting the treatment, the total urine output is 300 milliliter. This is the mean value, mean value of 56 patients. And after the treatment, after the 2 months of the treatment, this urine output is 1.6 to 1.6 liter, and after the 1 year it is 1.88 liter. And swelling, which was severely swelling, anasarca, that is the score number 3. After the 2 months it is 1.5, and then sometimes occasional swellings are there. Sometimes it is off and on, specifically related with the position of the patient. So it is 0.5. Improvement in the laboratory investigations, specifically albuminuria and serum albumin, because in nephrotic syndrome, mainly albuminuria or proteinuria is there, serum albumin is low, and lipid profile is or dyslipidemia is there. So in albuminuria, initially when patient come to us before starting the Ayurveda treatment, they have 3.5 gram percent albuminuria, and after the 2 months it is 3.25, not much more improvement, but after the 1 year the albumin urea is only 2.1 gram percent, and serum albumin level, it is 2.19. It is very less, because minimum 3.5 milligram per deciliter is required as a normal value. And after the 6 months it is 2.47 milligram per deciliter, and after the 1 year of the Ayurveda treatment it raised up to the 3.4. So it's near to normal now, and that's why the improvement in the edema, you can say like this, or improvement in the lipid profile. In serum cholesterol level is also decreased from before treatment to the after the 1 year of the treatment, and HDL is also increased, not so much increasing, but also it shows the significant improvement. And triglycerides, which is the most dangerous factor are responsible for the complications of the nephrotic syndrome, that is the serum triglycerides and serum cholesterol. They both are decreased significantly, and in good amount decrement we found. Okay, so this is up to nephrotic syndrome and nephritic syndrome. So now if you have any questions related to the nephrotic or nephritic syndrome from modern side or from Ayurveda side or related to the treatment, anything, you just note down. We discuss later on. I prefer the questions more, because if you have more questions, you will learn more. Because in classics also, the learning method is questioning and answering. Because personally I believe that if you have questions, then you will have learning more. Because now I am telling you only those things which is in the slides, but there are many things behind the slides. There are many observations behind these clinical treatment schedule and clinical pictures which I am showing you in the slides. That all observations which I had in my mind, I cannot present at here because of the lack of the time. So if you have questions related to that, or whatever the questions, that will be answered, and so you will have learn more. Now we go to the another part of this another disorders, that is the chronic kidney disease, which is also known as a CRF, or also abbreviated as a, now recently everybody or very sonologist also mentioned it is chronic medical renal disease. So CKD, CRF, and chronic medical renal disease, they all are one like a synonyms. So chronic renal failure or chronic kidney disease, it is an irreversible deterioration in renal function, specifically EGFR or GFR decline, and generally it's developed over a period of years. So if GFR continuously declined more than or equal to 3 months, and there is a structural or functional loss of the kidney excretory or any other functions of the kidneys, if it is lost more than 3 months, then this condition is called as the chronic renal disease or chronic kidney disease. Not chronic renal disease. If you say chronic renal disease, it is, there are all types of renal disorders which is in chronic form, they come under this roof. But chronic kidney disease, CKD, that is the renal failure. And mostly symptomatology, everybody knows it is nausea, vomiting, and swelling, nephritic phase, icterus with the pruritus, muscle cramps, headache, loss of appetite, many are there. But mainly serum creatinine, blood urea are increased. So there are azotemia with or without uremia. I think you understand what is the difference between azotemia and uremia, and these common things. I say that I believe that you understand these common things, so I am not going very much detail in these cases. Main etiology of these chronic renal failure is the diabetes mellitus, hypertension, polycystic kidney disease, glomerulonephritis or interstitial nephritis, some overuse of analgesics and other uh, antipsychotics or narcotics medicines, autoimmune process, and certain non-specific causes are there which nobody can know, or but something like pesticides use and uh, chronic illnesses like that. According to the modern medical science, diabetes mellitus is the most common and the main cause for the chronic renal failure. And second most common is hypertension, and chronic glomerular nephritis is the third most common. and all other causes, chronic intestinal diseases or ischemic nephropathy, obstructive uropathy, or analgesic nephropathy, all other, they are in very rare causes, in the rare causes. But I have some question mark, because now recently, since last 5 to 6 years, the diabetic nephropathy cases are less in compared to the hypertensive nephropathy cases in my practice. So I have make a question mark, which is put at here, against diabetes 41% and hypertension 22%. This is according to the modern medical science, which is mentioned in the 2010. But now in more cases are hypertensive nephropathies are there in compared to diabetic nephropathy. Disease burden is not mandatory or not required at here. Everybody knows these things. The CIF ranking is increasing. In 1990, the common death, worldwide death cause of the CIF is on 27th. In 2010, it was 18th. And in 2017, the CRF is the 12th cause of the death. Hemodialysis is also increasing. It may be more double in 2030. This is the expectation within these 20 years. The most common risk factors, according to the common clinical studies, that is the low socioeconomic status, recurrent dehydration, lifestyle behavior, diet pattern, stress, physical and mental both. So phobia is also inside, and heat stress. Before we go to the another slides, this slide is important because it is related with the risk factors. So recently we have completed one research work which was sponsored by the under the studentship of the CCRAS. One of our student has completed this research, which was cross-sectional study, and on the making of Nidan Panchak of the chronic kidney disease, because chronic kidney disease, it is modern disease, and there is no directly any nomenclature disease in our classics which can correlate with the chronic kidney disease. So it is our duty to make a Nidan Panchak through classical way. And she got certain risk factors or positive factors for the patients of CKD. So first cause identify, that is the Daiva and Vishamashana. So Daiva, mostly those patients who had some history, past history related with the some specific work, or no any other specific causes, they are Daiva. Another main cause is Vegdhara, specifically upon Veg related Vegdhara, and certain Mutrava Srotas and Vedadushti disorders like Ashmari, Mutrakutsa, Pameh, and Sthaulya. They are the most common causes for the CKD patients. Bijadosha, Amadosha, Balabranch means autoimmune process, or Ama is also one of some causative factors of the CKD. So these are the Ayurvedic causes which we have identified. This is 100% from the patient. So it is evidence based. It is not just a logically. It is evidence based. So you can understand that which Nidan can create the CKD now according to Ayurveda. Now this is the pathophysiology of the CRF. Positive factors create some injury inside the kidneys, specifically in the glomerulus or also inside the tubules. So that's why the biochemical abnormalities is started, eventually loss of the excretory, metabolic and endocrine functions of the kidney. So certain nephrons which structurally affected, they lost their functions. But certain amount of the nephrons which are normally inside the kidney, they can continue their work. So that's why in the CKD patient, initially biochemical abnormalities is only there, but patient are totally asymptomatic. And sometimes patient didn't identify that they have CKD. And when they have some symptomatology, they found that the serum creatinine level is 6 or 7, and they don't know about it. So this is the main cause why they do not have these types of clinical pictures, because initially patients' nephrons are slowly structurally lost. So at that time, compensatory nephrons work is continuous, which is in the form of hypertrophy. And this compensatory hypertrophy, it also creates the extra burden, because if there are 5 persons work, and if you give all this work to only the 1 persons, then 1 person is overloaded. So the same thing is happen inside the kidneys or the nephrons, this parenchymal cell of the kidney. So 50% lost their functions, so 100% work should have to be done by the 50% nephrons. So that 50% nephrons has extra burden. So the survival of that nephrons is survival chances or surviving pattern is also altered. And that's why they nephrons are also lost their functions within a shorter period, and further damage, progressive dysfunction is there because of this mechanism, and ultimately patient terminated into the ESRD, that is the end stage renal disease, in which patient require renal replacement therapy. Two types of renal replacement therapy is there. One is the hemodialysis and another is transplantation. So how we can understand this mechanism of the Ayurveda? See, before I again say that we cannot directly correlate the CRF in the any nomenclature disease of our classical textbook. And that's why I think this Charak Sutrasthan, chapter number 18, this Charak has mentioned that Vikar Nama Kusalona Jihiriyat Kadachana. So how we can understand anything, or how we can treat the patient? So at here in the Charak has quoted that if you have a knowledge about the dosha, dushya, vitiated site of the dosha, means the srotas of srota dushti, and if you have knowledge of the nidan, then you can treat any of the disease, whether it is nomenclated, whether this Nidan Panchak is available, whether the Chikitsa Sutra is available in the classics or not. You can treat the patient. If you have wonderful knowledge or everything of the dosha, dushya, sota, srota, dushti, and Nidan of that clinical condition, you can make a treatment strategy by your own hand. So now the doshas. So the main pathophysiology, whether it is in diabetic nephropathy, mainly in diabetic nephropathy and in other nephropathy, the microvascular structures are blocked. So the blockage of the microvessels, microchannels inside the nephrons, they are the main pathophysiology in the diabetic types of nephropathy. So these microchannels blockage is because of the kaphadosh. The guru, snigdha, pichila, these are the guna by which kapha increased or vitiated and create the blockage of the microchannels. Second, that is the inflammatory changes, which we already understand as in the form of nephritis. So in the nephritis, this inflammation is initiated by the pitta. So pitta dosh is responsible for all types of inflammatory processes or necrotic processes inside the kidney damage, and Vata dosas are the responsible for the degeneration of the structure of the kidney. See, what is the degeneration? Degeneration means the structural loss of the nephrons. Nephrons, they are the functional unit, and mainly they are from the glomerulus and tubules. These glomerulus and tubules are from the epithelial tissues mainly. So the tissues is replaced by any scarring tissues like fibrous tissues or calcified tissues or whatever. This process is called as the degenerative process. And this degenerative process is responsible for the structural loss of the nephrons, and the structural loss ultimately functional loss. So main is Vata responsible. Why Vata is responsible? Because Lagugun is of the Vata is responsible for the degeneration. Suppose if you have a very heavy dense ball, so the weight of this dense ball is because of the density which is inside the ball. If you remove this density, then what is happening? This ball will be hollow. There is some space inside the ball because the structure, dense structure, which is lost. So the functions of that ball is different. It's just like a rubber ball instead of matches ball. So this is the Laguguna of the Vata, and this is responsible for the degeneration. So the degeneration or structural loss, or we can say scarring tissues instead of the functional tissues, these all are because of the Laguguna of the Vata. This Ushna Tikshna of the Pitta is responsible for the inflammatory processes or necrotic processes of these kidneys, and Kapha is responsible for the microchannels blocking. This Guru Snigdha Pichila of this Kapha dosh is responsible for it. So these are the main things for the Kapha. Or see, there are the common guna of the all three doshas. There Lagu guna is common in Vata and also in the Pitta. Snigdha guna is common in the Pitta and also in the Kapha. And the Shita guna is common in the Vata and the Kapha. So if you make a tripod, then Vata, Pitta and Kapha is the all these three corner. Then there is in the line from between Vata and Pitta, you can write as a Lagu. Between Pitta and Kapha line, base line, you can write as a Snigdha, and Vata and Kapha you can write like a Shita. So what is the difference between Vata's Shita and Kapha's Shita? What is the difference between Vata's Lagu and Pitta's Lagu? They are not same. So if you know these things, you can go for the making a treatment strategy. You are able to make a treatment strategy. Just for example, if you understand that why this tremor is there in the Parkinsonism, because of the chalaguna of the Vata. So if you know that it is because of the Vata, then there are 100 or thousands of the procedures and the treatment which is anti-Vata. Among them, which is responsible to create the result in this Parkinsonism, specifically tremor as an anti-Vata principles. Because tremor is because of the Chalaguna, then you have to use the Sthiraguna. And that's why this Bala and Kapikachu is useful in the relieving the tremors in the, because Kapikachu we always say to everybody that it is because it contain dopamine. No, why we go for the dopamine? Think like this. Because of this Thiraguna of the Kapikachu, it is the opposite to the Chalaguna. That's why it reacting on it, it specifying the Vata dosha by its Thiraguna, and that's why the tremor is decreasing. So if you think like this dosha is responsible, or this dosa can help you, the knowledge of these types of dosa help you to make a treatment strategy of any kind of diseases. So dushya, initially mutra, udaka, sveda, rasa, rakta and sira. Sira is upadhatu, but still it is dushya because dhatu, upadhatu and mola, they are the dushya. So sira also, because microvessels blockage, so we have to also include the sira. So these are the main basic dushyas. Initially, they are the vitiated, and later on, all dhatus and updhatus are vitiated. When patient is in the form of ESRD, then all types of dhatus and updhatus they involve in pathological form. That's why all dhatus updhatus are the dushyas. How we can understand it? See, one by one. There are fluid and electrolyte imbalance in the majority of the patients of the CKD. they have low immunity, or they all patients are immunocompromised. They get more, they prone to infections. So, and also some cardiovascular risk is increase in the patients of CKD. So when we consider all these factors, we can say that it is ras and udaka dushti inside the patient's body. Anemia and bleeding tendencies is also common as a one of the sign and symptoms of the CKD. So this anemia and bleeding tendency, we can directly say that ras and rakta dushti. Myopathy, that is mansa dushti. Patient's dyslipidemia, that is the medas dushti. Renal osteodystrophy is a common complications of the CKD patients. So that is also related with the asthi dushti. Neuropathy, tingling sensations, common uh, numbness, or sometimes patient cannot feel some sensations. So that is the snayu dushti. So personally, I believe that majja is central nervous system and snayu is peripheral nervous system. I think that's why Pakshaghat Kujarak has mentioned the snayu dushti along with other dushti. So majja asthi issue. In Ashtanga Majja I mentioned for Majja is Asthi Shu, means inside the Asthi. And if it is what is inside the skull, what is inside the spinal cord, sorry, inside the spine, that is this brain with the spinal cord. So Majja is the brain with spinal cord, and all peripheral tissues, they are the snayus. Loss of libido and sexual function dysfunctions is also inside the patients of CKD, that is the Sukradushti. So, if patient has all the symptoms, specifically in ESRD patient or uh, stage 4 5 patients of the CKD, then all the dushyas are there. Specifically, Srotas, as I discussed that initially certain srotas are there, but later on when disease advances, all srotas are involved as per the all dhatus. Multi-srotas involvement is there. Types of srotodushti is Shang and Vimargagaman. Shang and Vimargagaman, they are the main pathology of the srotodushti. But there are also all four types of Srotodushti, Ati Pravrutti, Sangha, Vimargagaman, and Siragranthis are also there. If there is a cystic enlargement, encapsulated cysts are there. In many sonography of the patient, many patients, the sonologist has written that there are certain cysts inside the kidneys. That is because of the in a mechanism of the injury, I saw that proliferation or hypertrophied. huh, That is, they develop this hypertrophied mechanism is developed the cystic. It progresses the cystic enlargement inside the kidney. So that is again it is Sira Granthi. So all Srutadustis is there inside, but mainly Sangha and Vimargagaman is there. Related to the Agni and Ama at every level and all Agni, Tattvagni level, Bhutagni level, or Jatragni level, at every level Agni is Mand. And personally, I believe that Mal Sanchay Rup Am is there, present. At here, it is very important to tell you that why I believe that Mal Sanchay Rup Am. There are four types of Am mentioned in the Madhav Nidan by Vijay Rakshi. One is Pachakagni, means the Jatragni Mande Janya Am. Actually, this is not the types of the am, but this is the types of the production of the am. How the or by which type the am is produced inside the body. That is the first is the Jatragni Mande Janya Am. Another is Dhatavagni Mande Janya Am. Third one is the Mal Sanchay Rup Am, and fourth one that is the Prathama Dos Dushti Janya Am. So among them, Mal Sanchay Rup Am we discuss at here. So if that is the arm or sorry mala, if it is accumulated inside the body, that is also work like the arm. So what is mal? there are mainly three malas are there, mainly three. One is Purisha, then Mutra and Sveda. So what is Mutra? Among Purisha and Sveda, just forget about it. Now we tell Mutra. So what is Mutra according to Ayurveda? Mutra is different from the urine. See, urine is this, we can say, we can translate the Mutra as a urine, but exactly Mutra is not equal to urine, something else. Uh, See, in Ashtanga they have mentioned that Mutrasya Kleda Vahanam and Svedasya Kleda Drit. These are the functions. So Mutra function is the Kleda Vahanam. So if Mutra is increasing inside, if elimination of the Mutra is more, then because of the functions of the Mutra, the clay is also eliminated along with this Mutra. So if something is directed to the another thing, then we can say that both are things are different. So if clay is migrated by the Mutra, then how can we say that clay is equal to Mutra? They both are different. And if clay is normal clay, is the mainly, we can, clay is a very debatable, uh, we don't want to go for the details inside the clay, but I say that if normal clay, mainly you can correlate them with waters and electrolytes. So if water is migrated or eliminated by the mutra from the body in the form of the, when mutra is goes outside or eliminated from the body, that means mutra and these water substances are different. So in the urine, when you remove the watery substances, whatever the solutes inside the urine, they are the mutra according to the Ayurveda. Because of this statement, I am telling only the evidence-based statement. See, I am not just give you the logical base, logic base. This is the evidence base because evidence mentioned in the Ashtanga Sangraha, Ashtanga Hridaya, that is the Mutra se Kleda Vahana. So that's why Mutra and Kleda are different. And that's why if you remove the watery substances, whatever the solutes, what are the solutes? Solutes are serum create, solutes are creatinine, solutes are urea, solutes are the other ammonium products, solutes are the uric acid, solutes are the waste products which is over number inside the blood, sodium, potassium, like that. They are inside the urine. These solutes are according to Mutra in our Ayurveda. And if they are increased inside the blood, that is the Mutra Rupi Malasanchaya. So what actually happen in the kidney disorders? Serum creatinine raise, blood urea raising inside. So urea raising inside the blood. If it is raising inside the urine, it is normal. But it is raising inside the blood and not inside the urine. So this is Mala Sanchaya, Mutra Rupi Mala Sanchaya. So Mutra Sanchaya Rupi arm is there. Udvav Sthan is Pakvashayot. Everybody knows that because Mutra is produced as basically. Basically, if you go through the way of the anatomical and physiological according to the modern medical science, you never understand this statement of the classics. But the functionally, it is directly correlated with the Pakvashay, and that's why, which I tell you in the later on about the Nirubasti, its work in this case is because the Pakvashay disease is there. Rog Marg, initially Madhyam Rog Marg, because it is Marmasti Sandhi. There are three Marma is there, Basti, Shir and Hridaya. Basti is related with the kidney. So that's why I believe that it is Madhyam Rog Marg. But later on, in ESRD on the third or fourth or fifth stage of the disease, we can say that all Margas are there. The disease is of all Marg. And that's why this incurability, one of the reason of the incurability of this disease is Trayo Marga is there. Now we knows everything about the Samprapti and its analysis of the CKD patients. So now how we can use this knowledge of all the Samprapti factors for making a treatment protocol. First one is the Nidan Parivarjan, and this Nidan I already told you, because through the evidence, through this research, we have obtained some Nidan, Ayurvedic Nidan. Not diabetes, hypertension, they are the Nidan which is mentioned by the modern medical science. We also consider them. We also treat the patient anti-diabetic medicaments and everything. But another nidan which are responsible, that also to be considered for nidan parivarjana. Repair of the vyadhi adhishtan, that is the kidneys, nephrons, and which are the factors? Kapha guru, snigdha, these are the guna, vata, chala, lagu gun degeneration. These are the factors which we have to repair, and then vyadhi adhishtan can be repaired. Supporting the excretory functions. See, when there is a structural loss is there and irreversible stages are there, we cannot generate the nephrons, new nephrons, but we can prevent the degeneration of the nephrons. So that is the rasayana, and that is the fourth one, that is the dhatu poshan. So if you give the overburden or 5 persons work to 1 person, and if you are giving daily chanpras, milk, ghee, honey, and wonderful medicines and wonderful diet and exercise is also, then that 1 person are able to go for the same work at least for more than 10, 15, 20 days, or there is less tiredness of that person is possible. So this is the effect of the rasayana in the nephrons work burden and supporting excretory functions. So there is one bifurcation of the kidney functions. If you bifurcate the kidney functions, that means if you support the excretory functions of the kidney through another way, that is the supporting excretory functions, that will be possible through the Nirubasti, that I will discuss later on. Nidan Parivarjan, avoid causative factors, that already, this is the Pathya. You have already the PPT, so I don't go everybody. You can see this. This is just a list of the Pathya, and this is the list of the Apathya. You just follow it blindly. Shamana treatment, which is helpful for the repairing of the Vyadhi Adhisthana, that is the Lekhana and Mutrava Srotas Rasayana medicaments. Varunadi Kvat. Varunadi Gan is mentioned as a Medadushti Nashak, or it acts on the Medava Srotas and Medas according to the Susrut. And VRUKKA is the mula of the Medava Srotas, so Varunadi Kvat may helpful. This is my personal logic. So that's why we use the Varunadi Kvat and we got the results. Gokshura the Gugulu, because of the Gugulu and Gokshura and Triphala, Trikatu, Musta, they are responsible for the Lekhana properties, and Gokshura itself also having the Mutrava Srutas Rasayana properties, so that it will helpful. Rasayan Churna, it is combination of the Gokshura, Amalki and Guduchi. It is also mentioned in the Ashtanga Hridaya, this Rasayan Churna. Not with the name of the Rasayana Churna, but all these three combination is mentioned. So Gokshura is good for the kidneys, Amalki is good for the heart, and Guduchi is good for the liver. So generally it help at every level inside the body. And Bhumyamlaki Churna, we identified Bhumyamlaki as a wonderful medicines for Snayu related, means the peripheral nervous system, specifically in the diabetic patient. And we also use the Bhumyamlaki Churna in diabetic patient to prevent and to treat the complications of the diabetes mellitus. And some of the patients we identify that they also have a wonderful life quality in diabetes because of the diabetes mellitus when we are using the Bhumyamlaki Churna. So also we have started the Bhumyamlaki Churna in the patients of the CKD, and more useful in the diabetic nephropathy induced CKD. Now the Shodhana effect is there. Nirubasti we are giving the everyday before the, better to say on empty stomach, because if patient is on empty stomach, you can also give it at the 4 o'clock even in the evening. So these are the ingredients of the Nirobasti which we are using in the hospital. One observation is Basti, if it is retained near 20 to 30 minutes, then it's help more. So it is helpful to support the excretory functions. How it will helpful to support the excretory functions? For that thing, we can understand that if there is some problem in the family, if mother who is a good cooker, and if she ill, then all the other family members are not starved. Father can go something in the kitchen and make something not delicious like mother, but they can survive through that way. So this is the common example. Same thing is inside our body. That is the real holistic medicines. What is the reality of the holism of the Ayurveda? That I believe personally like this, because holism means not only the mind, body, and that is the very uh, shorter aspect of the understanding of the holism, but in deeper aspect, each and every cell try to be a helpful for to the another cells of the body. That is the holism of our body. And now this holism is just like a pathophysiology, just like a statement of the modern medical science, like a that is the homeostasis process of the body. So that's why if the one excretory system of our body fails to excrete, fails to underwork for their functions, then another excretory systems can, not as much as like the urinary systems, but some kind of work can be possible by another excretory system of the body. And Apanavat, which is responsible for the Mutrava Srotas functionality, the same Apanvat is also responsible for the functionality of the GI tract, or we can say it is the Purishva Srotas. So if we go through the Pakvashaya, if we go through the Basti, see, I directly say Basti, specifically Niru Basti, then this Niru Basti helpful to increase the excretory functions of the Purishva Srotas or the GI tract, bowel, which helpful to decrease the overburden of the excretory functions of the kidneys. And in Ayurveda, it is mentioned that this basti material is go through each and every cell of the body, each and every part of the body through the virya of that basti. Now, basti is not directly reach at any part of the body because absorption is not possible, but it goes through their virya, that potency, the potency inside the medicines, it's reached at that level. Now everybody say that gut brain, modern medical science now go for the maximum research work on the gut brain. What is this gut brain? Our acharyas, our ancient vaidyas, they knows about this gut brain, and that's why they make this statement that this potency is reaches at that level, at every part of the body through that way. So this gut brain can transport the potency of that medicaments, which is, and that's why this vata can treat it through basti. If basti is absorbed from that way, then why we cannot give to the oral? It will be better absorbed. But the anti-vata principles is through the, for the basti is the anal canal route only because of this aspect. So basti will work at here like this. Rasayana medicines, Rasayan Churna, as we discussed, Bhumyamla ki Churna, Chivan Prashavale hai. Brahma Rasayan is also useful. Now we are using also Brahma Rasayan. And Dhatu Poshan is helpful specifically by the Rasayana. And the patients who are in the first stage or having a very less problems with the electrolyte imbalance, no swelling, or in the first stage or second stage, creatinine level is less than 3.0 milligram per deciliter. We also go for the Snehapana with the Goksura, the Grit, but specifically only in these cases, or not all the cases. And then after the Samyak Snehapana, 2 days of Abhyanga Sedana, and the third day Virechana Karma, then follow the Sansarjana Karma. So Virechana Karma procedures with Goksura, the Grit, Snehapana, we follow. And then in this case, we also go through the medicines and the Basti, which already discussed. Some avasthiki chikitsa also, because patients of this condition are in critical. They have also sometimes nausea and vomiting. So what we can do? We are using Chardi Ripu Churna if nausea and vomiting is there. If some patient has hyperacidity syndrome, we use Sankapashma. In low urine output or excessive swelling, also we use the Punarnava. Otherwise, you have seen we are not using the Punarnava in the patients of CKD. That if you have question, okay, just forget about it. We have very less time now. It's 3:50. Muscular cramps, weakness, body ache. In this case, we use the magnesium sulfate, which is also mentioned Sindhu Thalavan in the Ayurveda, but specifically Sindhu Thalavan is very less available in the form of purity. So we use the magnesium sulfate, which is available in the market. In anemia, Dhatri low, and in severe anemia, I suggest blood transfusion. Low serum calcium or high phosphate level, Asti Shrinkla Grit. We using hyperkalemia, restrictions of the fruits, and remove the water after boiling the vegetables, and Nirubasti. These are helpful to remove the hyperkalemia. In hypokalemia, again we use the magnesium sulfate, coconut water, fruits, and Sarjika Kshar or Yavakshar. In hypernatremia, again Punarnava and magnesium sulfate. So now the results, see, we have more than 4,000 patients every year. We have nearly 400 average outdoor patients per month, and every month new patients, nearly 300 of the CKD we have in our hospital since many years. And these are the publications. These publications is only on the CKD. Total 8 publications, and 9th, which is not published, but already the report is submitted to the CCRAS. That is the Nidan Panchak, which we already discussed. So these all 8 publications in very reputed journals. So the results of these all 8 is not possible, but some results I mention it here. In case this is the patients of 145 cases of CKD patients. In these cases, we have observed the patient's renal function test presently when patient come to us first time. That is the RFT 0, which is mentioned at here. Just before starting the Ayurveda treatment, when patient come to us, we see the renal function test at the time of the hospitalization or at the time of the starting the treatment. Just before starting the treatment, whatever the value of the renal function test and whatever the symptoms and signs, they are recorded. They are never given the name as the time point 0, renal function test time point 0. And we ask or we see the reports of the patients before the 6 months of the today's date, plus or minus 5 days is there. And we also record the same renal function test. That is the time point 1. So time point 1 is before the 6 months record of the renal function test of the today's. And then we start the Ayurveda treatment. And after the 6 months of the treatment, again in the same patients, we have observed the renal function test value and also the signs and symptoms value. That we abbreviated it here as the renal function test time point 2. So in time point 0 means presently patient's GFR value is 11.95. And before these 6 months, patient's GFR value is 20.58. So we can say that if patient is not taking any kinds of medicines or any kind of Ayurvedic medicines or whatever the nephrologist has suggested, they are medicines they are taking during that 6 months period, the GFR is deteriorated. So GFR goes down from 20 to 58 to 11.95 even after they are taking the antihypertensive or anti-diabetic or any other medicines suggested by the nephrologist. Then we have given the Ayurveda treatment. So the GFR is increased from 11.95 to 17.01 after the 6 months of the treatment of the Ayurveda. So we can say that GFR is increasing. Even the patient is in the progressive disorders, we can prevent this progress and also reverse this progress, then the GFR increment is possible. This is the level of the GFR and also the serum creatinine level, hemoglobin level. Signs and symptoms, it is nearly mostly good result we obtain. It is nausea, vomiting, swelling, they all are decreased. This is the very good slide. So maximum 53 patients are there, and among them majority patients, 40 patients are in stage 4 and stage 5, and only 13 patients is in stage 2 and stage 3. Now after the 6 months period, means when they come to us with the allopathic treatment, among them all the patients of stage 2 and 3 they converted into the stage 4 and stage 5, and 6 patients of the stage 4 they converted into the stage 5. So all the patients are all in the stage 4 and 5. But when we have started the Ayurveda treatment, the 30 patients is only in stage 5 after the 6 months of period, and total 23 patients they are in the stage 3, stage 2 and stage 4. So we can also Ayurveda treatment, we can say that Ayurveda treatment is able to shift the many patients of stage 5 into stage 4, stage 3 and into stage 2. So we can reverse the progress of the disease. Now the another results of the another CKD publications, that is in the non-dialysis patient but only in the stage 4 and stage 5 patient. In this also the pre-treatment period of is same, like GFR is decreasing, and after the Ayurveda treatment the GFR is increasing. Urea is also decreased, not too much difference between the hemoglobin level, but in creatinine level, we found the difference, significancy. In post-treatment, in Ayurvedic treatment, it decreased from 5.94 to the 4.80. So this is also the 3D printing of this Ayurvedic treatment effect. Another effect, another study, that is just 2 years period, and all the patients included in the study, they are the dialysis dependent patients. So in only 48 patients we have who are on the hemodialysis within this 2 years period. So before treatment, the total number of patients, these total number of patients on the hemodialysis are 48. And after the 1 year of the treatment, 6 months of the treatment, only 23 patients they are on the hemodialysis. All other 25 patients they don't require the hemodialysis since last 4 5 months. So we can say that 25 patients Ayurveda treatment is able to just stop the hemodialysis. This is a very big achievement of the Ayurveda treatment. Now the frequency hemodialysis, average frequency of per patient is 5.90 in month. So in 30 days, the uh, average frequency of the hemodialysis or patient is go for the 5.9 time hemodialysis in month, average patient. And after the 6 months of the Ayurveda treatment, now the average is reduced up to 1.73 from 5.90. The mean score of the GFR is also increased, and the serum creatinine level is also decreased. Serum creatinine level is not so much decreasing at here because it is from 8 to 7.79, not significantly decrement we found. But see, the all the patients are on the hemodialysis. So when they are going for the hemodialysis, their serum creatinine level is maintained because of the hemodialysis. But even after stop of the hemodialysis or even after reducing the frequency of the hemodialysis, if the serum creatinine level is not more than the 8, that is the achievement. Blood urea is also decreasing, means curve the hemoglobin is not increasing. See, this is the significant reduction we found in the patients, 9.8 to 9.3. So we do not have any result in the hemoglobin. So some requirement of the hemoglobin level is still researchable in the Ayurveda field. So certain observations. Number one, if CMD is preserved and serum creatinine level is less, then we have maximum output of this treatment. But when kidney size is reduced, corticomedullary differentiation is lost, and serum creatinine level is higher, and then patient come to us, then we have a very less result of the Ayurveda treatment. Second, the same thing at here also, the CMD maintaining, then good result, CMD poor or lost, not good so result. In diabetic nephropathy, more result good because in diabetic nephropathy generally structural loss are less, functional loss are more than the structural loss. So in diabetic nephropathy, good result observed. In autoimmune etiology, least response is there. My personal opinion of this observation is that because of the autoimmune etiology, the progress is very fast than the other etiology. So that's why I think Ayurveda treatment is less effective in autoimmune etiology. Observations related to some herbal medicines that like ashwagandha, jatamansi, yashtimadu, and punarnava, they are harmful in the patients of CKD. Harmful. See, I okay, we do not have much more time, so I'm not discussing why this may be harmful. What are the logic behind it? Rasaushadhi deteriorates the EGFR, specifically Parad and Dhatu Bhasma, but Mandur Bhasma, we have observed that it says very less. Shank Bhasma, Gudanti, these are the safe. You can use it. Daiva Pasra Chikitsa has a wonderful role. If patient is in positive mood, then the effect of the treatment we observe more than in other cases. So that's why we are uh, using the mantra chikitsa in our college and hospital. We start our work with the ritual functions, that is the daily agnihotra, that is the home havan at the 8 o'clock, and we finish our work at 5 6 o'clock with Vishnu Sahasranam. I am not telling to everybody that do like this, but you can go if you are not belonging into the Hindi rituality, you can go for anywhere. But the main thing is that Samdaya Vyapasaya Chikitsa has a good, not good, but wonderful role. It enhances the effect of the Ayurveda treatment. Sattva Chikitsa, positive mentality, that already medicine enhance effect. And integrative approach, I believe this that integrative approach is now necessary, specifically in those patients who are taking antihypertensive or anti-diabetic medicines, allopathic side, then we continue them, because if you go for the treatment of the diabetes and go for the treatment of the hypertension, then you will not deteriorate the progress of the kidney function, kidney progress or kidney disease. So better to continue them, or if some response of the Ayurvedic medicines is there, we have also observed these things. That's why I'm telling you. Then you can modify the dose with the help of some allopathic physician, or sometimes in some patients we identified that many patients they do not require anti-diabetic or sometimes anti-hypertensive medicines after some period of the Ayurveda treatment. But initially, I am not suggesting you to stop it because it drastically changes the blood pressure or sugar level and harmful for the patients. So require in majority generally fourth and fifth stage of the CKD patients, this integrative approach. Generally first and second test patient, if they do not started, if they do not taking their antihypertensive or antidiabetics since many years or many times, then generally uh, they do not require it. So integrative approach is way less requirement in the stage 1 and stage 2 patient. Ayurvedic treatment can reduce the need of the dialysis and hence postpone the reduction of the frequency. So it can postpone the renal transplantation and add some more months or years of the post-transplant life. So this is the effect of Ayurvedic treatment which I have shown you. I wish you a healthy and happy normal kidney functions, everybody. Thank you very much.
Thank you, sir. Sir, your insights and your perspective on Ayurvedic understanding of kidney disorders was truly valuable, and we were all motivated by your personal experiences and the results of your case study, sir. So there are some questions that have been.
Questions, yes, questions is always appreciated.
Sir, I will be displaying them on the screen, sir.
Okay. Yes, good question. Any sanskara before administrations? No, because there are two types of rasayan therapies is there. Naimitic rasayan do not require any types of sanskara. And this is naimitic rasayan. It is just for the removing the disease, not for the healthy individual to getting any rasayana properties. So I think I do not believe in this sanskara before administrations of any type of rasayana medicines, not only in the Vardhamana Pippali, but in any kind of rasayana medicines which we are using as a naimitic rasayana. No need to go for any pre-sanskara. No need to go for any virechana karma or anything. You can directly go for it. What is the Ahara Vihara during Vardhamana Pippali administrations? Good question. See, not only Ahara Vihara for the Vardhamana Pippali in the case of kidney disorders, but from first day of the starting the Ayurveda treatment to the death, the same treatment which I have told you as a pathya, and we are using rice, moong bean, boiled vegetables, and 100 milliliter milk. Not other than this. If patient want to eat any other things or want to eat chapati, then only rice flour chapati or moong and rice combined flour chapati. No jar, no bajra, no makka, means no any types of millets, no any types of wheat, no any types of other grains instead of rice, and no any other types of uh, beans instead of moong beans. Whether shamana aushadis are administered for particular time or lifelong in nephrotic syndrome. Yes, not in only nephrotic syndrome, but also in the CKD, lifelong medicines for each and for all the time, because we cannot generate the nephrons. If nephron is generated, then it is, I think it is not because of our medicines, it's because of the gift of the God, or maybe the patient's Daivya Chikitsa. So that's why, as a physician, I suggest the patient not to stop any kinds of medications if it is not required or if it is not suggested by any physician. What specific medications you suggest initially for reversal of microalbuminuria? Yes, In microalbuminuria, generally the causative factors is responsible. If it is diabetic patient and if you treat the patient anti-diabetic Ayurvedic medications or some Ayurvedic medicines which is specifically not useful for the only reduction of the blood sugar level, but they are useful as a madhumeha or in the prameha, like bhumyamalaki. And also, I have personally used Gokshura and Gokshura the Gugulu, Punarnava also. Then this albumin urea, you can treat it. So Pramehagna Aushado, because Prame itself, it is the not turbidity of the urine, but it is the alteration of the components of the urine. Huh? It is clearly mentioned by the Chakrapani that what is the meaning of avil urine. Avil is not a turbidity. Avil is the altered component of the dhatus, updhatus, which is inside the urine. So albumin urea, phosphate urea, hematuria, these all are prameha. So go for it. Go for the treatment of this prameha. Inputs on role of panchakarma therapies other than basti in maintaining homeostasis of gut brain kidney axis. Yes, in when the patient of CKD is there or patient of nephrotic syndrome is there, then see these are the very critical condition. In when you start the to treat the patient of these types of condition, and after if you have daily 10-15 patients treating experience, you observe that many patients come for the Ayurveda treatment, they are in critical condition. They have anasarca, they have massive albuminuria, they have immunocompromised, repeatedly infections. Sometimes when we admit the patient and on the same day in the night, they have 104 degree Fahrenheit fever. So this is the status of the patients. So in this case, how can you say that there is any role of the Panchakarma procedures or specifically Shodhana? So I believe that if patient is in the first stage, initial stage with good bala and asymptomatic, no clear the abnormalities inside the body, then there is a good role of the Panchakarma procedure, specifically Virechana Karma. I do not believe for the Vamana Karma because Vamana itself increase the Udavarta. And Udavarta is the main causative factors for Trimarma Roga. That's why I think Charak has mentioned first Udavarta and then start the um, another material of the three marma chikitsa in three marma chikitsa adhyay. So Udavarta is the main causative factors for all three marma. That's why Pratisha and everything is because of this Udavarta. So if you go for the Vamana, I think you increase the Udavarta. Because this is totally Vata aggravated patients are there. And if you go for the Vamana, then it is very stressful and but in specific conditions in first stage, and if there is kapha excessive which has blockage the channels, vata has not too much role, then you can go for the Vamana. Virechana is good in majority of the cases, but Vamana be careful. I generally do not prefer in many of the cases. So Pipali chuna used along with milk or lukewarm water in Vardhamana Pipali Prayoga. Yes, Pipali chuna is used with lukewarm water, not the milk, because if it is cow milk and purely uh, obtained with the good condition of the cows or good taking care of the cows and then milk is from that cows, then you can use the milk after boiling, removing the skim, and then use it. You can use this milk uh, even more than 230, 300 or 400 milliliter. But if you are not sure about the milk, then don't use milk 200 milliliter more than 200 milliliter in a day in this kind of patient. because this milk which is now presently available in the market, this milk containing many bad proteins which are again used as an antigen inside the body of these types of patient, and that's why again you are increasing the process of the antigen antibody complex and antigen antibody in situ process, like that. This is the autoimmune, so particularly it will increase the disease progress. So better to go for the lukewarm water, or you can go for the honey. Patient is not having a asthma condition, then you can go for the honey, or not a fever, then you can go for the honey. Up to what level of serum creatinine can be managed through Ayurveda? Serum creatinine level can be managed wonderfully if it is less than 5.0 milligram per deciliter, and patient's condition is good, patient's health is good. Symptomatically, less symptoms are there, because at least not more patient, but 10-15 patients of all the CKD patients, they have many symptomatology, have 4.5 or below the 5.0 milligram per deciliter of serum creatinine level, and they have NSRK, they have more than 6.0 gram percent milligram per deciliter serum potassium level, and require hemodialysis even. So in this case, definitely we have less result, but another 85% patient whose serum creatinine level is less than 5 and less symptomatology is there, good strength is there, we obtain a wonderful result with the Ayurveda treatment. But when the serum creatinine is raising, as I have mentioned in my observation, and if corticomedullary differentiation is lost, it suggests that many nephrons are destructed inside the kidneys. Then serum creatinine level is more than 7, 8, or 9. Or those patients who are on the hemodialysis since more than 2, 3, 4 months and now come to us for the Ayurveda treatment, they have less chances to get a reverse of the serum creatinine level. But in these cases also, I give the assurance to the patient that definitely they will have a increment in their quality of life. That assurance you can give them. Whether plain pipli chuna used in Vardhamana pipli prayoga? Yes, why not plain pipli chuna? I have also used in Vardhamana pipli plain pipli chuna. Treatment of Shotha associated with medical renal disease complicated by diabetes mellitus. Yes, Shotha. In Shotha, you use the Punarnava, or you use the Gokshura Churna, and we use Ikshumul Kvat when excessive Shoth is there and hyperkalemia is there. Then these Ikshumul Trinipanchmul is also containing the Ikshumul, but Ikshumul is more reliable because it is easily available, and whatever the Ikshumul is there, it is less adulterated. So that's why Ikshumul I prefer more, and personally I have used it. It also decreases the Shotha. And specifically in diabetic patient, if you are using the insulin, or if patient is not taking insulin, but associated with the high blood sugar level and Shoth and medical renal disease, then send them to the allopathic physician, or if you are have availability of the allopathic physician in your consultation hospital, then you take the discuss with it and start the insulin therapy. Insulin therapy will dramatically give the result in the Shoth, specifically in medical renal disease of diabetic nephropathy. Kidney care through Ayurveda medicines in hypertensives to prevent hypertensive nephropathy. Hmm. See, personally, I have no any experience because I have not given any specific treatment in the patients for hypertension related benefit after stopping any antihypertensive medicine. See, so how can we say that Ayurveda medicines help? But some kind of help Ayurveda can give you. Not only it has, we cannot say that it has directly antihypertensive effect, but indirectly they can help to maintain the blood pressure level. Because in many cases during our practice, I have observed that those patients who are on the hemodialysis or those patients who are not in hemodialysis, but their EGFR is less than 20, then they have mortal hypertension. They are taking Nicardia retard 20 milligram one tablet three times in a day. Arcamin, Mindiclinidipine tablet, one tablet three times in a day. And also the moxanidine and these any two, three medicaments, the four or five medicaments continuous three times in a day, but still they have more than 170, 110 mmHg blood pressure. So this is the mortal hypertension which generally observed in the patients of CKD who are in the stage 4, 5 or on the hemodialysis patient. So that's why I'm telling you this is a critical condition, not so much easy just like you are hearing it here to treat the patient. And that's why in these cases, because there is no any option in the allopathic treatment also, so when we have started to add the Gandhira, in there are also the achar of the Gandhira available in this Gujarat state. So we are not giving the achar, but so Gandir is easily available at everywhere. This Gandir we are giving. I forgot the botanical name of the Gandir, but Gandir is the Sanskrit name. We are starting the Gandir, and some patients, not always all the patients, but some patients has some antihypertensive benefit with this Gandir, and also at the same time also we are using the specifically one medicines from the Ayurveda, that is the tensionil, which contains some kind of jatamansi, some kind of tagara, which relieve the anxiolytic effect, also gives some effect. But it is Goksuradi, Rasayana Chuna, and another medicaments, they indirectly helpful. And some patients automatically they maintain their blood sugar, blood pressure level is maintained. So later on, but exactly we cannot say that, we cannot assure the patient that these are the medicines you take and you will have definitely hypertension benefit without any antihypertensive allopathic medicines. This is reality, fact. Next, what is the average survival years for CKD patients on Ayurveda treatment? Very varieties. But now, since last 5 years, the survival years of the CKD is decreasing. This is personal, uh, practical experience. This is not evidence based. There is no any publication on it. Whatever the publications are available, they are before 2015s. So recently, there is no any survival years or the progressive years ratio showing any evidences. But during my last 5 years practice, I can say that the survival years are decreasing. Earlier, the patients CKD who are detected in the first or second stage with microalbuminuria or with serum creatinine ranging like 2.0 milligram per deciliter, and they are asymptomatic, and if they are using some treatment and good anti-diabetic or antihypertensive medicines and good diet control and everything is there, then they require at least 10 years or 15 years or 20 years to enter into the stage 4 or stage 5 or in the CSRD stage. But now I have observed that this is evidence based. That is the published in my paper in Journal of Alternative and Complementary Medicine Journal publication. that is the in that cases I have observed that the patients who are in stage 2, they converted into the stage 4 and stage 5 within a 6 months period, within the 6 months period. So we can say that the survival years of the CKD patients is now decreasing. Next. Rationality for not using Punarnava, Jatamansi, Ashwagandha, etc. drugs. Okay, so this is the good questions because I also want to tell you these things, but at that time, not a time. So Punarnava, see, my personal belief is that Punarnava is not Mutral. No any medicines except Kshar Parpati or Yavakshar, they have Mutral action. All are Shothar. Punarnava is Shothar. So it has just removing the edematous condition. That types of action is there. So how it will work? And Punarnava is also Radhya. So Radhya, by increasing the cardiac output, they increase the pressure in the renal artery through this function, and because of the radhya they increase the output increase the pressure in the renal artery. This pressure in the renal artery increase the GFR rate, and ultimately if there is no any other abnormalities of the electrolytes, then this whole fertile this uh, material, filtrated material, they remove through the urine, and ultimately you will have a more urine, and you will have a less edema. So these are the Sothar effect of the Punarnava. So Punarnava is useful. I think Punarnava is useful to increase the blood pressure level, specifically in the renal artery pressure, and then it will increase the urine output and become a show or function as a shoth herb. So if you give Punarnava, then you are increasing the blood pressure. Okay. But if there is any patient with the cardiovascular risk, or if it is in the first stage, second stage, and require some Punarnava shoth therapy, you can go for it, but not for a longer period. Ashwagandha and Jatamansi specifically, I have seen in the patient, if you are using Ashwagandha and Jatamansi longer period, then they have GFR, that GFR is deteriorated. So it may be harmful. How it will harmful, that's I don't know. And another thing is that this is not mentioned. Okay. Sarpagandha is also a nephrotoxic effect. Next. Is there any specific drugs in Ayurveda acting on diabetic nephropathy? Yes, these are the medicines. You, if patient is diabetic nephropathy, then all these medicines you use it. Homeopathy is more useful in diabetic nephropathy and diabetic neuropathy. In diabetic neuropathy, Balamul is also useful. But in nephropathy, mainly Varunadikvat and this Gugulu, Shilajatu. Yes, Shilajatu and Gugulu, both these medicaments. So Shilajatvadi Vati, which containing also Dhatu Basma, if you modified it and containing Shilajatu, Gokshura, Guduchi, Triphala, and Gugulu. So modified form of Shilajatvadivati which doesn't contain any Basma or Parada, that will be more beneficial at here. We are using uric acid tablet in diabetic nephropathy. It is branded, but it is modified form of Shilajatvadivati, and we already specifically give the suggestion to the owner of that pharmacy, and they have prepared it for particular diabetic nephropathy patient. We are using it and good result in nephropathy also. So Gokshura, Gugulu, Shilajatu, Varunadi Gan, and Bhumyamlaki. This is the good if you have diabetic nephropathy at first stage level. Next, finish.
Yes, sir. Thank you for
Yes.
engaging question so detailed, sir. Uh, I request Dr. Sanjay Kumar, sir, Professor, Department of Kaya Chikitsa, JMC Mysuru, to speak a few words about this session.
Respected guest speaker Manish sir and HODs of different department, postgraduate students on the webinar now. I personally wish to congratulate Professor Dr. Manish Patel sir for such a wonderful, one of the finest and authoritative presentation on VRUKKA. We had an expectation of like how should be a particular presentation which should cater to our UG students, PG students, practitioners, researchers, and all. So this particular one presentation, in this particular presentation, he has touched all the audiences, where the basically the analysis that he has taken from the basic principles of Ayurveda and raising it to modern science was very wonderful. It is, in fact, I feel that it should be a model presentation for anybody who presents on such a bigger platform. For even for us also, like how you go about taking from the first year students analyzing the basics of Ayurveda with dosha dushyas to relating it to the finest and in-depth knowledge of modern and not only just presenting the concepts. Most of the time when we go in different seminars, we have different conceptual presentations. We feel that they are more hypothetical unless they are put into test. The best part of Sir's presentation is whatever he has taken in a rationality part in Ayurveda modern, he has tested it with a particular selection of drugs and then making it a clear-cut case studies, research presentations, and proper statistics were used, and the results were published. So basically, it's a model for all our postgraduates, motivation to our all postgraduates that just not doing things or documenting is not enough. We should publish it. So probably Sir might have written many books also. So I personally recommend for all postgraduate teachers who wish to learn more about kidney disorders, I can go through his publications. I personally was so much impressed, sir. I was on throughout that I was observing like how we go about and how you went about and all. There were some similarities also. We had difficulties to treat the fourth and fifth stages when they were on dialysis and all. And you address those issues also, and you have a different group of where with dialysis, without dialysis, and so altogether, it was one of the finest presentation. And I personally, and on behalf of our department, other staffs, I thank you, sir, wholeheartedly for giving valuable time. I know you are on travel. I was in touch with you. We were traveling. Just came just 2:30 before 2:30. You came back and you started presentation. Thank you very much, sir. I don't have any words to express my gratitude for your authority. It's, we made time, but the authority, everybody doesn't want to share. Some people may not have a presentation skill, and God has gifted with you with all qualities. God bless you, sir. Once again, thank you very much.
Thank you, sir, for your valuable time and your insights and perspective on Ayurvedic understanding and the treatment. You've motivated us all, sir. So I wholeheartedly thank you for sparing the time for us, sir. And I also thank all the speakers that were a part of the national webinar series on kidney disorders. So with this, we conclude the 3-day webinar series on the kidney disorders of VRUKKA Prakarshha 2023. Thank you, sir.